You are about to watch a video about healthcare. But before you do, here is one fact you can take with you right now, even if you stop watching in 30 seconds. In 1945, the United States came within a single Senate vote of becoming the first country in the world to guarantee every citizen free medical care. It did not happen. And the reason it did not happen was not a lack of money, not a lack of public support, and not a disagreement among doctors about medicine. It was a single, coordinated, well-funded campaign that deliberately rebranded the idea of universal health care as a foreign threat to American freedom. That campaign worked, and the country has been paying for it ever since. But how do you turn a medical policy into a symbol of national danger? And who had the power to do that in 1945? Think of it the way you think of a product recall. A company discovers its product has a flaw. Instead of fixing the flaw, it hires an advertising firm to convince the public that the people reporting the flaw are the real danger. The flaw stays, the critics are discredited, the company keeps selling. That is not a hypothetical. That is exactly what happened to universal health care in America, and it happened not once, but 4 separate times across 80 years. The story begins not in a hospital, but in a Senate chamber. The year is 1945. Franklin Delano Roosevelt, the 32nd President of the United States, who had led the country through the Great Depression and the Second World War, had died in April of that year. His successor, Harry S. Truman, a senator from Missouri who had never attended college and worked as a farmer and a haberdasher before entering politics, took office with one major domestic ambition. He wanted to build what he called a national health program, a system in which every American, regardless of income, would be able to see a doctor without paying out of pocket. Truman sent his proposal to Congress on November 19, 1945. It was called the National Health Program. It proposed compulsory national health insurance funded through payroll taxes, covering hospital care, physician services, and nursing. Truman called it, in his message to Congress, a right that should be enjoyed by every American. So, if a popular president with a Democratic majority in Congress proposed universal health care in 1945, why did it fail so completely that it never even came to a vote? The answer is the American Medical Association. The American Medical Association, known as the AMA, was founded in Philadelphia in 1847. By 1945, it was the most powerful professional lobbying organization in the United States, representing the majority of American physicians. When Truman's proposal reached Congress, the AMA responded with what historians have since called the most expensive lobbying campaign in American history up to that point. In 1949, the AMA hired a public relations firm based in San Francisco called Whitaker and Baxter, founded by Clem Whitaker and Leone Baxter, a husband and wife team who had built their careers running political campaigns in California. The AMA paid Whitaker and Baxter approximately $1.5 million, equivalent to roughly $19 million today, to defeat Truman's plan. And what was the strategy Whitaker and Baxter used to defeat a healthcare proposal that opinion polls showed most Americans supported? Whitaker and Baxter's strategy was documented in their internal campaign materials, which were later analyzed by the historian Paul Starr, a professor of sociology and public affairs at Princeton University, in his 1982 book, The Social Transformation of American Medicine, published by Basic Books and winner of the Pulitzer Prize for General Nonfiction. According to Starr's analysis, Whitaker and Baxter built their campaign on a single word: socialism. They printed and distributed more than 50 million pieces of literature across the United States. They placed advertising in newspapers, on radio, and in doctors' waiting rooms. Every piece of material carried the same message. Compulsory health insurance was not a medical proposal. It was the first step toward a Soviet-style government takeover of American life.
Think of it the way you think of a fire alarm in a building with no fire. If someone pulls the alarm, the building empties. It does not matter whether there is a fire. The alarm works because people are trained to respond to it automatically before they have time to check. Whitaker and Baxter pulled the alarm. The word socialism was the alarm. And in 1949, 4 years after the end of a war against totalitarian states, the alarm worked perfectly.
But was Truman's proposal actually socialism? And what do the primary documents from that period say about what it actually contained? Truman's proposal, as written in his November 1945 message to Congress and reproduced in the public papers of the Presidents of the United States, contained no provision for government ownership of hospitals, no provision for government employment of doctors, and no provision for government control of medical decisions. Doctors would remain in private practice. Hospitals would remain privately owned. The only change was the payment mechanism. Instead of patients paying doctors directly, a federal insurance fund would pay on their behalf. This is structurally identical to the way private insurance works, except that the insurer would be the government, rather than a corporation. The AMA and Whitaker and Baxter knew this. They described it as socialism anyway. Truman's proposal never came to a vote. It died in committee in 1950.
And what happened the next time a president tried to build a universal system? And did the same strategy get used again? The next attempt came 13 years later, under a different president and in a different political climate. John F. Kennedy, the 35th President of the United States, a senator from Massachusetts who had been elected in 1960 on a platform that included federal health care for the elderly, proposed a program called Medicare in 1961. Medicare was a narrower proposal than Truman's. It would cover only Americans aged 65 and older, funded through Social Security payroll taxes. The AMA opposed it with the same tools Whitaker and Baxter had developed. In 1961, the AMA launched an operation called Operation Coffee Cup. The campaign asked the wives of AMA member doctors to host coffee mornings in their homes and play a recorded speech for their neighbors. The speech was delivered by an actor named Ronald Reagan, then known primarily as a television host for the General Electric Theater program and not yet a political figure, who had been hired by the AMA to record the address. In the recording, Reagan argued that Medicare was the first step towards socialism and warned that if it passed, Americans would one day find themselves telling their children and grandchildren what it was like to live in a country that was free.
What did the historical record show about what actually happened to the countries that did introduce universal health care at this time? Did they lose their freedom? By 1961, the following countries had already introduced universal or near-universal healthcare systems without becoming socialist states. The United Kingdom in 1948 through the National Health Service. Canada, beginning in 1947 in the province of Saskatchewan and expanding federally through the 1960s. Australia, through a series of hospital agreements beginning in 1945, and every Western European democracy, without exception. None of these countries had experienced the government takeover of other industries that Reagan's speech predicted. None had ceased to hold free elections. The evidence available in 1961 directly contradicted the claim being made in Operation Coffee Cup. The campaign ran anyway. Kennedy's Medicare bill failed to pass Congress before his assassination in November 1963.
So how did Medicare finally become law? And what does the political history of its passage reveal about what it actually took to overcome the AMA's opposition? Medicare became law on July 30th, 1965, under President Lyndon B. Johnson, signed into law at the Harry S. Truman Presidential Library in Independence, Missouri, with Harry Truman, then 81 years old, seated beside him as the first beneficiary. Johnson was able to pass Medicare for two reasons that had nothing to do with a change in the AMA's position. First, the assassination of Kennedy had produced an enormous Democratic majority in both houses of Congress in the 1964 election. Second, Johnson was one of the most skilled legislative operators in the history of the Senate and applied personal pressure to individual members of Congress with a directness that historians have documented in extensive oral history records. Medicare passed, but it covered only Americans over 65. Every American under 65 remained without guaranteed coverage. The universal system Truman had proposed in 1945 remained unbuilt.
And what happened when the next serious attempt at universal coverage came under a president whose own party controlled Congress and whose spouse led the effort? The third major attempt at universal health care came in 1993 under President Bill Clinton. Clinton's proposal, developed by a task force led by Hillary Rodham Clinton, a lawyer and policy expert who had served as First Lady since January of that year, was called the Health Security Act. It proposed a system of managed competition in which every American would be enrolled in a health plan through regional purchasing alliances, with an employer mandate requiring companies to provide coverage for their workers. It was not a government-run system.
It relied entirely on private insurance companies operating within a regulated market. The Health Insurance Association of America, a lobbying group representing private health insurers, responded with a television advertising campaign that became one of the most analyzed political advertising efforts in American history. The campaign featured two fictional characters named Harry and Louise, portrayed by actors sitting at a kitchen table and expressing anxiety about the complexity and government control embedded in the Clinton plan. The campaign ran in targeted congressional districts. It has been studied in detail by the political scientist Darrell, a professor at Brown University, in his 2010 book, Air Wars, Television Advertising in Election Campaigns, published by CQ Press. Clinton's Health Security Act never came to a floor vote in either chamber of Congress. It was withdrawn in September 1994.
So after 80 years of failed attempts, what does the data actually show about the consequences of not having universal coverage? What has the absence of a universal system cost Americans in measurable terms? The data is precise and comes from peer-reviewed sources. In 2003, the Institute of Medicine,
a division of the National Academies of Sciences, Engineering, and Medicine, the body established by Congress in 1863 to advise the federal government on scientific matters, published a report titled Hidden Costs, Value Lost on Insurance in America. The report estimated that between 18,000 and 22,000 Americans died each year as a direct result of lacking health insurance, not from their underlying illness, but from delayed or absent care that insured Americans would have received.
In 2009, a study published in the American Journal of Public Health by Andrew Wilper and colleagues at Harvard Medical School estimated that 45,000 Americans died annually due to lack of health insurance. The United States spends more per capita on health care than any other country in the world. According to data published by the Organization for Economic Cooperation and Development, the intergovernmental body whose members include all major industrialized democracies, the United States spent approximately $10,000 per person on health care in 2019, more than double the average of comparable nations. Life expectancy in the United States in that same year ranked 28th among the 38 OECD member countries.
And what does all of this mean for you, not as a historical fact, but as something that operates in your daily life right now? Here is the structural observation. Every time you make a decision about whether to see a doctor, every time you weigh the cost of a prescription, every time you calculate whether a symptom is serious enough to justify the expense, every time you stay in a job you do not want because it provides health insurance, you are living inside a system whose shape was decided not by doctors, not by patients, and not by any democratic consensus about what medicine should do.
It was decided by a public relations campaign run in 1949 by two people whose job was to win and who found a word that worked. The word was socialism. It worked in 1949. It worked in 1961. It worked in 1993. It has continued to work in every policy debate since. You did not choose this system. You inherited it. And the argument that locked it in place was never about medicine at all. In 1945, Harry Truman sat in the White House and wrote a message to Congress about a right that should be enjoyed by every American. 80 years later, you are still paying one bill at a time for the campaign that stopped him.